Hi, Tanya from Created Health, Nutrition and Fitness. So most of us know somebody who has cancer or has suffered with cancer themselves, and we know that cancer is the second leading cause of mortality worldwide. We also know that our incidence of cancer increases with age, so I suppose you could call it a age-related disease. Cancer development and accelerated age both have the same risk factors attached to them, and they are physical inactivity and also having a unhealthy diet. So when it comes to preventative measures for cancer, the public health recommendations are, if you are a smoker, to stop smoking, particularly in regards to things such as lung cancer. Other public health preventatives for cancer are things like vaccination. There is a vaccination for hepatitis B virus, HBV, and also the HPV vaccination. The other public health preventative measure against cancer is screening, particularly breast, cervical and colorectal cancer. So currently those recommendations and concepts for preventing cancer have not actually prevented cancer as of yet. So we're always looking at what we can do and what is available to reduce our risk of cancer and to prevent getting cancer in the first place. So when we look at things like vitamin D in preventing cancer, it works in a couple of different ways. So it inhibits the growth of the cancer cells by regulating several genes that are responsible for the proliferation and differentiation of cells. So that's like the growth of the cell and the dividing of the cell. We know vitamin D has it regulates the sequencing of cell division. We also, when we look at observational studies and vitamin D, there is an association with having low level vitamin D blood levels, so low vitamin D, which we look at in blood serum when you go and have a blood test. So we look at that and your total risk of cancer, and there is a correlation between those two. Vitamin D in research has been shown that it may reduce the advancement of cancer, and it may also reduce fatal cancers. Now, when we look at omega-3 fatty acids and the prevention of cancer using omega-3s, there's been a lot of research around that, and we know that it inhibits the carcinogenesis through suppressing inflammation. There's a lot of talk, particularly nowadays, and a lot of research around reducing inflammation in the body to create homeostasis and balance and health in the body. And omega-3 fatty acids does that because it reduces inflammation, it reduces the proliferation and the angiogenesis of cells, so the making of new cells. Lipid metabolism of cancer cells has recently gained a lot of attention, and the reason for this is we have found that with your balance of your omega-3 fatty acids to omega-6 fatty acids, if your ratio is balanced, then that reduces inflammation in the body. So your lipid metabolism is really important when it comes to preventing cancer. We also know when we're looking at omega-3 fatty acids, we're looking at there's evidence that the acidic cell cancer can, there's basically death to acidic cancer cells using omega-3 fatty acids, and this is done through a process known as ferroptosis, and ferroptosis has to do with iron levels in the blood. We also know when it comes to preventing cancer that exercise is recommended, and this has a couple of different pathways. So we know that exercise reduces inflammation, and we know that inflammation causes disease and disharmony within the body and imbalances within the body. We know that exercise improves our immune function, and we know when our immune is functioning healthily and well, then we can control and reduce and suppress disease in the body, which cancer is. High physical activity reduces your risk of several different types of cancers. There's been research around breast cancer and physical activity for your survival rate and longevity of life after breast cancer. High physical activity will increase your cancer survival post-cancer. We also know with exercise, it induces apoptosis, which is cell death, to tumors, to cancer tumors. So I was looking at some research where they incorporated all three of these. They looked at, it's called, hang on, let me find that for you so that I can read what it's called. It's combined vitamin D, omega-3 fatty acids, and simple home exercise program may reduce cancer risk among active adults aged 70 and older. And it was a randomized controlled trial that was done. So they gathered 2,157 generally healthy adults aged 70 and over. So they were looking at, because cancer is considered an age-related disease, and the older we get, the more susceptible we are to it. This research was looking at how we can prevent it or control it or manage it in older age. So this research was done with people aged 70 and plus who were generally healthy people. So what they did, it was a double-blinded, randomized controlled trial, and it was conducted over a 3-year period. So it commenced in December 2012 and concluded December 2017. It was conducted over 5 European countries, so it wasn't just specific to one area in the world, but 5 different countries within Europe. And they looked at vitamin D3 as a high dose. Now, generally, vitamin D3, the recommended dosage per capsule is 1,000 international units. So they were giving them a high dose and doubling that. So they received 2 capsules per day. And the stabilizer that was used in the vitamin D3 was tocopherol. And then the omega-3 fatty acid that they were given was a marine sourced omega-3, and it was 1 gram per day, which was divided into 500 milligrams of DHA and 500 milligrams of EPA to make up that 1 milligram. In regards to the exercise, it was conducted twice a week. It was a easy at home strength exercising program that they underwent. And what they did with this trial, this is actually the first time that they've combined all 3. So they broke the participants into different groups. So they had one group that did vitamin D3, omega-3 and exercise. Then the next group, group 2, had vitamin D and the omega-3, no exercise. Then the next group had vitamin D and exercise, no omega-3. Then the next group had vitamin D alone. Next group, omega-3 and the exercise program. Then there were people that just had the exercise program and people that had the placebo. So in regards to the supplement range, they looked at what evidence shows us with dosage for brain health, muscle health, bone health, immune health, cardiovascular health, and that's how they got the dosage for the omega-3 and the vitamin D. At the end of the study, this was called the Do Health study, if you wanted to look at that also, which was quite interesting. But they did find that cancer risk was reduced when all three interventions were combined. So remember, at the end of the day, your health is your wealth. So as you get older, you want to not only have longevity of life, but good quality of life. So make sure that you are active, staying healthy, staying active, and incorporating a healthy diet. I'm Tanya from Created Health, Nutrition and Fitness.